Our next presentation will also be virtual, and it's by Guhan Rangaswamy, and he's from St. Luke Radiation Oncology Network. Welcome.
Thank you for the introduction, and good afternoon. My name is Guhan Rangaswamy, and I work as a clinical tutor in St. Luke's Radiation Oncology Network in Dublin. And as part of my role with the Faculty of Radiologists, which is the training body here, I'm involved in the curriculum development and training of the radiation oncology trainees who rotate through the higher specialist training scheme here. I'm also the education lead for the National Cancer Control Program, and the role here is not restricted just to the teaching of medics. I'm also involved in the teaching of radiation therapists and physics students. So I'd like to thank Dan and the ROECSG committee for giving me this opportunity to present our experience of setting up content tutorials for our radiation therapists. Okay, so I'd like to start with a brief overview of radiotherapy services in Ireland. Ireland is a small country of 5 million, of a population of 5 million, of whom 1 million live in and around the capital, Dublin. We have 3 training sites. We have 5 public centres, 3 of which are based in Dublin, in Radgar, St. James's, and Beaumont. This constitutes the St. Luke's Radiation Oncology Network, where I'm currently working. We also have a centre in the west in Galway, and another centre in the south in Cork. And these are also attached to university hospitals there. I'd also like to describe the radiotherapy service development in Ireland over the last 20 years. Back in 2002, when I started training, there was 1 public radiotherapy centre in Ireland. We had 6 LINACs, predominantly 3D conformal radiotherapy. And then in 2011, we became a network with the current structure of 3 training sites. And then, as you can see, over the last 10 years, there's been a rapid development in advanced radiotherapy techniques. And as I said in the previous slide, we currently have 5 public radiotherapy centers distributed across Ireland. We have 22 LINACs with routine use of advanced radiotherapy techniques and with ongoing plans for further expansion. So in terms of radiation therapists, go back to the previous slide. So sorry about that. Okay, so in terms of radiation therapists, so we have Trinity College Dublin, where there is an undergraduate degree course from which radiation therapists graduate. It's a 4-year course that culminates in the issue of a Bachelor in Science in Radiation Therapy. We have between 20 and 30 graduates per year. We also have a master's program in University College Cork. It's a 2-year course, and there's usually between 10 and 15 graduates per year. At any given point, the 3 centers in Dublin are staffed by between 130 to 150 radiation therapists, and likewise, the 2 centers in Cork and Galway have about 50 radiation therapists each. So we know that radiation therapists play, I'm sorry about this. So we know that radiation therapists play an important role in the treatment planning pathway. A key component for training for radiation therapists is gaining knowledge and acquiring competencies in monitoring organs at risk in major tumor sites. At any given point, at least in St. Luke's, we have between 4 to 6 radiation therapists rotating through a planning CT rotation, scanning patients and monitoring OARs. The duration of CT rotation may vary anytime between 1 year and 5 years. This is on the background of them starting, having done probably little contouring in the undergraduate degree, and most of them may not have done any contouring in a considerable time. And any skills they acquire is usually acquired in an unstructured manner for more senior radiation therapists. And this is not standardized, and the knowledge that is then passed on to the most junior radiation therapists that rotate is also not standardized. That we also know that there can be a variance in contouring proficiencies amongst the radiation therapists. So in an attempt to standardize these contouring skills, we initiated a series of contouring tutorials. So between July 21 and October 23, so this is over a period of about 27 months, we conducted 10 content tutorials, primarily in OER contouring in head and neck and pelvis. So these were delivered via Zoom by myself as a clinical tutor and a consultant radiation oncologist. So each session followed a similar format over a duration of 90 minutes and was attended by radiation therapists from across the 3 centers in Dublin who were assigned to the planning CT rotation. A dedicated break of 90 minutes was factored in during their working day with the cooperation of the radiotherapy services manager to facilitate this. So all sessions were similar in format with a PowerPoint tutorial on the organ of risk, followed by a contouring demonstration of each OAR. And this was done on an anonymized space on the Eclipse planning platform. The radiation therapists were then given access to the PowerPoint presentation and the contoured phase after, and feedback on the tutorial was collected through a questionnaire after the tutorial from each radiation therapist. So this is an example of a feedback form. So this was from one of the head and neck OER tutorials that we conducted last year. So the questions range from asking them to score the overall format of the tutorial in terms of its usefulness and relevance to their daily practice. We also asked them to rate their subjective levels of confidence in delineation of head and neck OERs before and after the tutorial. We also asked them to suggest future topics for tutorials. So based on the feedback we received, an average of 7 radiation therapists attended these 10 teaching sessions. All the radiation therapists, irrespective of their level of experience, rated the content and format of the sessions highly and stated these sessions were relevant to their daily practice. I know the feedback is very subjective, but the reported level of confidence in OAR improved significantly from a baseline average score of 4.6. This is averaged out over the 10 teaching sessions to an average score of about 8.5 after these tutorials. So in summary, the aim of these tutorials was really to enhance the learning experience for radiation therapists and standardize these contouring skills. Based on the feedback received, it addressed some of the challenges faced in learning contouring skills by the radiation therapists. These contouring tutorials are now being planned on a more routine basis for each incoming cohort of radiation therapists rotating through CT. And then this will hopefully ensure that radiation therapists will continue to develop progressive expertise and standardization in contouring skills that's in keeping with best international practice. And as the previous speaker said, there is more widespread integration of auto contouring into the treatment planning pathway. So future plans include developing these tutorials into more interactive sessions and adapting them to editing contours provided by auto contouring solutions. Before I finish, I'd like to acknowledge the people listed on this slide for their help in conducting these tutorials. I'd like to thank Dan and the ROECSG committee again. I'm happy to take any questions or comments. Thank you.